All these chemical mediators are responsible for many events associated with the acute inflammatory response. They attract neutrophils and ease the movement of cells from the blood to the tissue damage. Removal of the damaged tissue prepares the injured area for tissue repair and maturation and healing. Plasma protein mediated. Many proteins are found in plasma in inactive states. They may be activated by antigen-antibody responses, bacteria, and chemicals released by damaged tissue. 3 protein cascades are associated with the acute inflammatory response. There's a clotting cascade. Results in a fibrous framework for tissue repair. Converts fibrinogen to fibrin and forms a mesh-like web with platelets to temporarily repair damaged vascularized tissue. So on this next slide you can see that the fibrin meshwork is formed, and it just basically lays down wherever there is damaged tissue. KINE cascade. Activated by factor 7 and Hageman factor. Converts pre-kallikrein to kallikrein, which then activates the conversion of kininogen to bradykinin, which the bradykinin before that we talked about, it does cause pain. Complement cascade. Family of plasma proteins that are involved in lysis, which is the breakdown of membranes of dead cells, chemical attraction of leukocytes, and increased capillary membrane permeability. Stimulates mast cell degranulation. Now we have the leukocyte mediated. Neutrophils are the predominant leukocyte in the area of damaged tissue following injury. Oxygen-free radicals are produced by neutrophils, activate collagenase, which break down adjacent cell membranes. The problem with these is they may also damage healthy cells, which can result in secondary tissue death. Neutrophils are short-lived. When they die, chemical mediators are released from the lysosomes. There are 2 groups of lysosomal enzymes. Cationic proteins, they increase the permeability of capillary membranes, chemotactic to monocytes, so large leukocytes capable of phagocytizing more damaged tissue than neutrophils. So they're going to come in and clean up the waste. They're found in high concentrations of patients with rheumatoid arthritis. They do attack articular cartilage, which can create joint dysfunction. Neutral proteases stimulate the complement cascade and the KINE system. Through lysosomal enzymes, the inflammatory response continues until the damaged tissue is removed. Vasodilation causes an increase in the amount and accumulation of blood in the area. This is also known as hemorrhaging, and this results in 2 of your cardinal signs, or 1 of your cardinal signs of inflammation, which is heat and redness. Vasodilation is accompanied by an increase in capillary permeability, volume, and pressure, allowing plasma proteins to leak out. These proteins, along with proteins from the damaged cell walls, attract water. More fluid between the cells equals more swelling. The increase in capillary permeability allows the passage of leukocytes to aid in the removal of waste. Here's a diagram of that. Margination. Leukocytes, or white blood cells, tend to move toward the area and adhere to the capillary walls. Margination and increased capillary permeability cause cells to migrate into the extravascular interstitial space, resulting in swelling and edema. So you're going to get this increase in fluid inside and outside the cells and in the vessels themselves. This is referred to as transudate because it's moving. Large proteins now escape from the capillaries into the tissue, which causes swelling. Edema is also known as exudate or extra fluid. This is the buildup of excessive fluid in the interstitial space as a result of pressure imbalance inside and outside the cell membrane. Edema is always proportional to the severity of the injury, which is the number of damaged cells, changes in the vascular permeability, which is going to increase with the severity of the injury, and the amount of primary and secondary hemorrhage, and also the presence of chemical inflammatory mediators. Neutrophils circulate in the blood and emigrate through pores in the capillary membrane to phagocytize the damaged tissue. Phagocytosis is the ingestion of cells by white blood cells, or neutrophils. This is all based on pressure types. So the movement of fluids across the capillary membrane are based on three forces. Vascular hydrostatic pressure, which is the pressure inside the cell. Plasma colloid osmotic pressure, which is the pressure outside the cell. And limb hydrostatic pressure. So this is the gravity dependent pressure. So this is where the reason we are going to elevate an injured area. Formation and removal of edema are based on the relationship among these pressures. So normally the vascular hydrostatic pressure and the plasma colloid osmotic pressure are even. However, with increased capillary permeability, the fluid is able to leave the vessels easier. So in this case, the vascular hydrostatic pressure is going to be greater than the plasma colloid osmotic pressure, which leads to edema. If the plasma colloid osmotic pressure is greater than the vascular hydrostatic pressure, fluids are forced back into the vessel and removed from the area. So this is the reason we use a compression wrap to aid in this process.